This podcast is for general informational, educational purposes only and is not to be considered medical advice for any particular patient. Clinicians must rely on their own informed clinical judgments when making recommendations for their patients. Welcome, everybody, to PHM from Pittsburgh. I am still your host, Dr. Tony Tarchichi. We are still coming to you from UPMC Children's Hospital of Pittsburgh in the Paul C. Gaffney Division of Pediatric Hospital Medicine. Now, this is an introduction to our special Journal Club series. This is a series of episodes we created to review statistics and research methodology and design for physicians. Now, you may remember in residency, or currently are in residency or going to residency, there are journal clubs. These are classes that are done to help you review and understand statistics and study design to help us all critically evaluate the literature. The reason for this is there is some fantastic research being done all over the world, but there is also some, shall we say, not so fantastic research being done. And we need to be able to tell them apart in order to help our patients. Here at PHM from Pittsburgh, we decided, well, being truthful, it was something I was considering, but a special thanks to the Pediatric Hospital Medicine Fellows at Dell Medical School in Texas, they gave me the nudge I needed to try and do this on a podcast format. This is a daunting task because we are using an audio-only format to cover a topic which usually has visual explanations to at least some parts of it. So first off, to even organize these episodes in a way that makes sense and knowing what to cover, we use the American Board of Pediatrics content specifications for pediatricians on what they call research studies, which includes basic statistics and clinical studies. We also looked at the content specifications for the pediatric hospital medicine subspecialty in the same area. So the question is, how should you use this journal club series? Well, if you've been in a journal club lecture in a residency program, I would urge you to use it the same way. We explain a concept, let's say sensitivity or specificity, give you a reasonable understanding of it, give you a framework to understand it in using real life examples or the examples from the articles, maybe give you an anecdote or two that's helpful, but we do not say you will get complete mastery of the topic based on these podcast episodes. Just like in a journal club lecture in a residency program, you don't walk out of those thinking, I'm never going to have to read or hear about that topic again. I fully understand it forever. So I would urge you to use these journal club lectures the same way. I hope they meet their goal. Now, we are trying to cover this whole topic on a podcast. So there's about 14 episodes, including this intro. You will note these episodes are shorter than our normal episodes. We felt it was helpful to try to keep these down to roughly 15 to 30 minutes or 20 to 30 minutes. Now, I want you to know this took us about 2 years to put together, which is why the podcast wasn't as active as it had been in the past. Because this took us so long to organize and put together, some of our references we make on these episodes may be dated, like when I got COVID or the beginning of the COVID pandemic. Normally, in a journal club in residency, you are assigned an article to read, all of you, and you then talk about. You use that article to discuss whatever topic you're talking about that day, like sensitivity and specificity. To do this appropriately, we want to do the same thing. So we handpick 3 articles that we will reference throughout the series. Now, not every episode uses them based on the topic we're covering, but we will announce early in the episode if we're using one of them and which one we'll be using or which more than one we'll be using. Now, I'm going to give you the articles here. So press pause if you need to get a pen and paper to write them down. Don't worry, I'll wait. Okay, there are 3 articles. Here they are. First, I'll give them to you in AMA reference format. So it'll be the authors by last name and first initial, then a name of the paper, and then where you can find it. So the first one, Courtney A., Bernard A., Burgess S. et al. The article name is Bolus versus Continuous Nasogastric Feeds for Infants with Bronchiolitis, a randomized trial. This was published in Hospital Pediatrics, Volume 12, Issue 1, January 2022. Now, we use this article the most in the series. It's a beautifully well-done paper by our colleagues in the Queensland Children's Hospital in Australia. So thank you to them. There's also the second article is Thomas J., Sucharu H., and pardon me if I butcher your name, Cruz A.T., Nigrovic L.E. The article is called Pediatric Emergency Medicine Collaborative Research Committee, HSV Study Group, Cerebrospinal Fluid Reference Values for Young Infants Undergoing Lumbar Puncture. This was published in Pediatrics in March of 2018, issue 141. Then there's Shu, that's the second article, pardon me. The third article is by Shu, S-C-H-U-H-S, Friedman S., Coates A., Allen U. et al., Effect of Oximetry on Hospitalization in Bronchiolitis, a randomized clinical trial. This was published in JAMA in August of 2014, issue 312. Now, if you've ever listened to this show, you know there's no way I could have done this alone. So I have two partners that I want to call out here who this could not have been accomplished without them. First is one of our colleagues from Dell Children's Medical Center, Dr. Lynn Thorson. Her fellows initially had this idea. She brought it to me, and we have worked together along with our third partner here at UPMC Children's Hospital of Pittsburgh in the Division of Pediatric Infectious Disease, Dr. Falana Ling Lin. They helped organize this, figure out what we should cover. We did this together, and I sincerely thank them, and this couldn't have been done without them. So they are my partners in this endeavor. And then I want to give a special shout out and thank you to all of our expert guests that were kind enough to give up their time for these episodes. So thank you to Doctors Matthew Wilkinson, Laura Vaughn, Mary Lou Clem, and Jenna Carlson, along with Rebecca Miller. So without further ado, everybody, I hope you enjoy these episodes. I hope they met their goal and you review or learn something. And thank you as always for listening.
Thank you for joining us for this Journal Club series at PHM from Pittsburgh. We want to especially thank our expert guests for their time.
Special thanks to the University of Pittsburgh for sponsoring the CME for this podcast, and UPMC Children's Hospital of Pittsburgh for supporting this podcast as well. We want to thank our friends at Dell Children's Medical Center and the University of Texas at Austin for their partnership on this endeavor.
Please email my dad at tony.tarchichi@chp.edu with any questions or comments. And as always, thank you for listening!